The Best Docs Network helps you find some of the best doctors utilizing the latest procedures and practices in healthcare. Actual patients and the doctors themselves walk you through their stories that together help you make the best decision in your search for the right doctor. On today's episode, reproductive endocrinologist Dr. Robert Kaufman talks about how his fertility practice offers the highest level of multidimensional patient care. Plastic surgeon Dr. David Altamira gives his patient the looks she's always wanted. Clinical psychologist Dr. Collins Hodges talks about the therapeutic techniques he uses to help children and adolescents. Houston Northwest Medical Center highlights their nurses' commitment to patient care as well as to their community. Oral surgeon Dr. Paul Metz improves his patient's life with dental implants.
At Fort Worth Fertility, what we really want to do is help our couples get pregnant, and we really believe this is the place for them. We can provide them with the best care from an emotional standpoint, from a success standpoint, and we can make you feel like you're in a unique situation here where we'll treat you as an individual and we'll do the very best we can to help you achieve your goal. We look for unique situations for our patients. We try to tailor what their individual needs are. I think the importance between our center and other centers would be we're very upfront with patients. We let them know what their expectations to get pregnant are. We let them know what it's going to take to get pregnant. We know financially what it's going to take for them to get pregnant. In addition, we offer numerous treatments. We offer inseminations where we put sperm inside the womb. We offer in vitro fertilization where we'll put embryos inside the womb. We can offer surgery. We can offer fertility medications. And there's a host of other things we can offer patients at this center, everything under one roof for the convenience of our patients. Our typical first patient appointment is where we'll actually spend probably about an hour talking about things. We'll talk about their history, we'll talk about possible evaluations they may need, and then we'll even start talking about potential treatments. When we talk about treatments, we'll let them know what their chances of getting pregnant are, how much it's going to cost, and what do they need to do. And so we really try to evaluate it thoroughly so we don't miss anything, so we can give them the best options to get pregnant. We're very proud of our egg donation program and surrogacy. We're known internationally for that. So it's not just Fort Worth. You think, oh, we just get doing things in Fort Worth. But we really see patients from all over the United States and all over the globe. And we're honored enough to be able to treat those type of patients here in Fort Worth. The other aspect here at Fort Worth Fertility is our staff. I think we have an outstanding staff, and we all need to work as a team to get the job done. We do know there's a lot entailed in helping our patients get pregnant. But we do try to find a cost-effective means to try to get our patients pregnant and give them our best advice on how to accomplish that.
Nuts are not only a source of healthful fats and protein, they also are a massive dose of omega-3 fatty acids that can help boost your brain power.
I had kind of a bump up here on the bridge, and the end kind of hung down a little bit. It was a little bit big. And I think a couple times in my life, guys had made comments like, oh, our kids would have really big noses.
Well, Holly came in with just the thought that had bothered her for a long time, that her nose just didn't match her face. She's an otherwise very attractive young lady, but she'd always had just a large nose that was out of proportion to the rest of her face.
I mean, overall, Dr. Altamira made the experience so easy and simple, and I think out of all the doctors that I spoke with, he was the one who made me the most at ease with the process, and he said, you can always do more, but let's do something modest for now, and it's just overall really comfortable.
First, we talked to the patient at length. We asked them what they like about their nose and then what they don't like about their nose. There are certain things that we can change and certain things we don't want to change if they're happy with that. We'll take several photographs from different angles, and then we can project them on the computer screen for the patient, and we can actually morph the images to show the patient what they can possibly look like. And And that way we can make sure we're on the same page as far as what the patient wants to look like and what can actually be accomplished in surgery, so that they do have realistic expectations, and we can kind of give them a good idea of what they actually will look like after the surgery.
The recovery time was really quick. Dr. Altamira had explained that it would hurt for a little bit. He even gave me painkillers, but I think I took 2 of them. It wasn't as painful nearly as I thought it would be. And I think I had some soreness if I would touch it for maybe a month after, but overall it didn't hurt.
Rhinoplasty is basically changing the shape of the nose. It can be done for a variety of reasons. Usually, a lot of times, just the patient has always felt their nose was too big for their face. They were never happy with their appearance. And so it's basically a great operation that can be used to reshape the person's nose to match their face better.
It was so exciting taking that Band-Aid off for the first time. Like, when you look at yourself in the mirror, you always notice an imperfection that maybe you don't like. And for the first time I looked and thought, oh, my nose is adorable.
Find your doctor on bestdocsnetwork.com.
I think people get the differences between a psychiatrist, a psychologist, and a counselor confused. So here are some of the major differences. A psychiatrist is a medical doctor. For the most part, their practices deal essentially with prescribing and then monitoring medications. Counselors have a master's degree in psychology or a related field. Psychologists have a doctorate in psychology. So my doctorate is in clinical psychology. I've had 8 years of training in both the assessment and intervention of children and adolescents, with a specialty in the emotional and behavioral problems that they present when they come in. You distinguish adolescent therapy from adult therapy in large part on what the developmental differences are and what the developmental task is for that age group. And that is, who am I? How do I fit into this world? When parents are debating whether or not to bring their kids in for therapy, the first piece of advice that I have for them is to sit down and spend some time talking with their child about what therapy means to them. My first session is always a consultation that doesn't cost anything, and so I want to use that time to really get across what it is that I do, but really, more importantly, to get an idea of how the child perceives his or her problems and what it is he or her wants out of treatment. What are his or her goals? I think it's really important to help adolescents understand who it is that they are and how best to fit in with other people. That's what makes those crazy years from 12 to 19 or 12 to 20 so critical. And so if I can help them get a greater understanding of that, developmentally speaking, then I'm doing my job.
John has a question for Dr. C.T. Nguyen. Is it bad to breathe out of my mouth?
Yes, mouth breathing can be harmful to your health. Mouth breathing can cause tiredness, lack of concentration, snoring, dental problem, and it can also depress your immune system. Please consult your ear, nose, and throat specialist for a solution.
Ask our doctors on bestdocsnetwork.com.
At Houston Northwest Medical Center, we're immensely proud of the wonderful group of nurses that we have at our hospital, not only for the care they give to our patients every day, but also for the way that they've reached out and become so involved in our community.
Their commitment to the patient here at Houston Northwest is amazing, but in addition, above and beyond these 4 walls, they carry it out to the community. And that's evidence in all their volunteer work, through runs, through patient support groups, through educational opportunities they offer to the community.
One of the reasons that I really like working for Houston Northwest is its philosophy, its commitment on giving back to the community. And so when an opportunity came up from Spring Independent School District for me to be a part of their education foundation, the hospital was very supportive in not only its financial resources, but allowing me the time to be able to participate at a high level of engagement with our school district.
Race for the Cure has become a really important tradition here at Houston Northwest Medical Center. Living the walk with these ladies, they allow you to walk beside them, behind them, in front of them, holding their hands. That's very important. That's something you cannot buy or you can express in words, really. I'm very honored. I am honored to be part of their lives and do whatever I can to help them along the way.
When I first started working here is when I got involved in the Heart Walk just as a participant. And after just participating for a couple of years, they asked me to kind of take it over. And so now that's what I do, is I help raise money for the American Heart Association Heart Walk.
Relay for Life is the biggest fundraiser sponsored by ACS. So American Cancer Society is always collecting donations to go towards patients that are underprivileged or that need resources when facing their diagnosis. It's humbling because I get to see patients come in that get a diagnosis that is life-changing, and then to be able to see them walk around the track as a survivor or one of their family members to walk around the track in remembrance of them. I feel lucky that I get to be the person to represent our hospital in that.
I love my job. It's fun. It feels good to be helping people live a healthier lifestyle.
Obviously, we're very proud of the quality of care that's provided at Houston Northwest Medical Center, and our nurses are the driving force behind that. But their commitment to quality care and their commitment to our community extends well beyond the walls of our hospital through the many charitable and healthcare awareness events that they participate in actively throughout the year.
I think that gets to the core of nursing here. There's a heart, a big heart.
Our bodies need at least 90 milligrams of vitamin C per day. The best way to get all your vitamin C is by making sure to eat at least 5 servings of fruits and vegetables every day.
My teeth needed to all be extracted. They were crumbling, they were breaking, I couldn't chew my food.
He's a professional, an accountant, and he's certainly concerned about finances and how to structure his budget. And he was a guy that his lower teeth were worse off than the uppers. And so that was an area that he decided to focus on.
I guess this started in 2009, and this really happened in two settings. So that in 2009, we did the lower, and in 2011, we did the upper. The bottom is all done, and I'm in the midst of having the prosthesis on the top done.
And also with David, his concern regarding his budget, we were able to do this without grafting. Previously, in the upper jaw, because of the maxillary sinuses, we would have to graft those areas in majority of cases that we were placing a full jaw worth of implants. But with the advent of cone beam CT, we're able to look at individuals from a three-dimensional standpoint radiographically ahead of time so as to know where the bone is so that we can position implants within that bone and avoid the need for sinus grafting and then subsequently lower his overall cost significantly as well as increase the predictability.
No longer do I have to make sure that everything is in place where it's supposed to be in place. I have a new chance at a brand new set of teeth, and they don't hurt.
It's satisfying to see him come back smiling, see him walking down the hallway, standing upright with their chin up, smiling and being much more confident. So it from a psychological standpoint, outside of the health benefits that you see, the mental health benefits are significant.
I'm a CPA. I meet with clients and high net worth clients. Appearance is important to me. It's certainly not of the utmost importance, but it's important to me. And I don't want to be embarrassed by a crumbling smile line. It's a wonderful, wonderful solution.
Brain tumors can be a very scary thing. I see a lot of patients who think they have a brain tumor. Most of the time they don't. Brain tumors are rare, but they can be very bad. So how do you know if you have a brain tumor? Well, headaches from a brain tumor usually are severe. They usually progressively worsen in severity and in how frequently they occur. And often they occur in the middle of the night. A headache that awakens you in the middle of the night is always a red flag to be checked out. Doesn't mean it's a brain tumor, but it just means it needs to be checked out to be sure. Also, if you have a brain tumor as the cause of your headache, you'll likely have other symptoms. For example, vision changes, double vision, numbness or weakness in one arm or one leg, inability to speak, maybe even a change in your bowel or bladder habits. So if you have any associated symptoms with a headache, or if it's a headache that is new, different, severe, and progressive, then talk to your doctor. Those are danger signals that need to be checked out.
Now my world has opened up. I occasionally go out with my girlfriends and we have a great time together.
I was getting older and didn't really care about my weight, but my doctor said I needed to do something immediately. Now I'm spending time with my grandchildren, and every moment seems special.
My one reason was to live life again.
My one reason was to simply live.
So what's your one reason?
Barker Bariatric Center. Log on or call today for your consultation.
Coming up on the second half of today's show, interventional cardiologist Dr. Annie Varghese talks about hypertension. Family medicine doctor Richard Honecker addresses common health concerns in our Medical Minute. Bariatric surgeon Dr. Scott Stowers gives us an overview of My Bariatric Solutions and their philosophy on patient care. ENT Dr. C.T. Wynn relieves his patients' inability to breathe and nasal congestion by diagnosing their deviated septum. Vein specialist Dr. Peter Morgan talks about varicose veins.
I noticed something wrong in July of 2008. I actually went to a routine doctor's visit for some breakout that I had because I had used a different type of deodorant. And when they took my blood pressure, they said that it was, unusually high.
Hypertension, what can it cause? And some people think, well, their blood pressure is a little bit high, they can take a medicine, or maybe they just don't have to take it every day. A lot of people take this idea of hypertension kind of casually, but we shouldn't, because high blood pressure can cause problems from stroke to heart attack to kidney failure. So many things can be caused by that one word, hypertension.
Ended up inevitably going to the emergency room like a couple of days after because I just started feeling really dizzy, headache. It was as if my heart was actually hurting inside of my body. The blood pressure was 200/110. When I came to see her, her first words were, "We're gonna heal you." And I was like, yes, came to the right place.
She has been committed and faithful to take her medicines and to take care of her body to protect her heart, because high blood pressure can lead to many other things, especially cardiomyopathies or weakening of the heart, heart failure from diastolic heart failure or systolic heart failure. So we have prevented that in her, and she's doing very well.
Before, I would feel sluggish, tired, anxious a lot, and a little headaches like that. And then after, once we started treatment on medicine, different medicines, I would feel better. I would feel like I had energy. I just felt better and good about myself.
If the pressure is too high, too much damage can occur in the organs. We have to take it seriously, and we just need to educate patients, I believe. If patients really knew what it was all about, they would come and get checked and take their medicine.
I believe that Dr. Varghese has been blessed from the Lord with life and favor, in her hands. And I just love that about her.
Request an appointment on bestdocsnetwork.com.
You hear a lot about sleep apnea. Well, sleep apnea is different than snoring. Snoring is just when you make a lot of noise, but your oxygen levels don't fall to dangerous levels. Sleep apnea is when your oxygen levels do fall because not only do you snore, but you gasp. Basically, you snore so bad or your airway closes so much that your oxygen level goes down, and your body therefore raises you up into a lighter level of sleep so that you don't die from that low oxygen level. That's when you chortle or gasp and you start breathing well again. Sleep apnea is a bad disease. It happens a lot in obese people, people with thick necks, and it can result in a far higher frequency of auto accidents. It can result in hypertension, low testosterone levels, depression, and we think even certain cancers. Now, how can you tell if you have sleep apnea? Well, ask your bed partner if you gasp. That would be suggestive. Ask your bed partner if your snoring is worse and worse. And you can get a little finger test done by your physician where you wear a little monitor on your finger overnight and see where your oxygen levels go throughout the night. If your oxygen levels go low, that's sleep apnea.
We are excited to have in the Best Docs Network studio Dr. Scott Stowers of My Bariatric Solutions, not only one of the top bariatric surgeons in the state of Texas, but around the United States. Welcome to the program, and let's get right to it. What makes My Bariatric Solutions different from the rest?
Every patient that comes through the door sees me. I evaluate every single patient individually to see what they need and what will work best for them. Every patient is followed all along the way with several of my staff who specialize in different aspects of their care.
There are a few different types of bariatric surgeries you can perform.
We do lap bands, we do sleeves, gastric sleeves, and we do gastric bypasses. We also do a revisional work where we change bands to sleeves.
You know, I think that what is very interesting is before you actually were a general surgeon, but you changed over in order to help people. How come?
Most of the work that I did as a general surgeon was the people were either obese or they were smokers. We were always fixing things. It was a cause and effect. So what I learned from that was I wanted to get on the other side of this. I wanted to prevent things.
Now, when an individual comes to you and they are not happy with themselves, what's the first step?
We look at the different aspects of their life, the different health problems that they may have, the likes and dislikes of their different lifestyles for each individual. And then we try to fit the surgery to that individual that's going to work the best for them.
One of the reasons why you changed from general surgeon to bariatric surgeon is because you see the results. You see yourself changing people's lives. What kind of feeling does that give you?
That's the reason I'm here. That's the reason I do what I do. This totally changes the end result of what people do, the end result of what their life's going to be, and it's the most gratifying thing that I think anyone can do.
All right, Dr. Stowers, appreciate the time. Dr. Scott Stowers of My Bariatric Solutions. Cindy has a question for Dr. Jeffrey Catarini. Can you tell me if a brain tumor is benign or malignant?
When a patient comes into the office, we can tell vast majority of time by looking at the CT and the MRI whether brain tumor is malignant or benign, meaning cancerous or non-cancerous. We know if a brain tumor is malignant or cancerous or benign or non-cancerous, usually by its location, enhancement pattern, size, and other surrounding structure effacement in terms of edema or swelling.
Ask our doctors on bestdocsnetwork.com.
I would wake up every morning sneezing. You know, I'd go into the bathroom and I'd sneeze over and over again, and really prevented me from doing any yard work. And so I would just kind of stay in the house and as much a filtered environment as possible.
Barry came to see me because he can't breathe out of his nose. He reported having nasal congestion, facial pressure, headache. And in addition to that, he suffered from obstructive sleep apnea that required him to wear a CPAP every night.
It started back when I was in grade school, and it just has gotten worse and worse and worse over the years. And most of the other doctors I've always visited would treat symptoms. I just assumed that's all they could do. And when I went to see Dr. Wendt, he said, no, here's the problem and here's a solution.
We noticed that Barry turbinate, which are structure on the side wall of his nose, are very swollen, restricting his airway. Also, Barry's sinus narrow and prevented him from breathing well. We discussed those findings with Barry and agreed upon a plan of treatment. First, reducing the size of the turbinate, allowing him to breathe better, and also using a small balloon to dilate the natural passage of his sinus cavity.
It took probably 2 weeks to feel really great. Progressively over that time, the breathing improved. You know, it's amazing. I told him I've never ever been able to breathe through both sides of my nose, and now I can.
After going through a small procedure in office of 45 minutes, now Barry enjoys life, breathes better, do more outdoor activities, and the most important thing, it reduces his dependency on CPAP machine, and he now can sleep better.
I was amazed because it was like finding somebody that was really willing to just do something more than put a Band-Aid on it. It was really exciting. Wish I would have found him 10 years ago.
Did you know that blueberries can improve your memory? Consuming blueberries helps to improve your memory by protecting your brain from inflammation and boosting communication between your brain cells.
benefits, what the side effects, and it gave me an opportunity to just weigh the pros and cons of whether I wanted to go forward.
The treatment is to close all the veins that are running backwards. Any vein that is not pumping up out of the leg is only hurting, it doesn't help. And so by removing or closing those veins, you restore the circulation out of the legs back to normal.
The procedure itself probably took 30 to 45 minutes. I was able to get up off the procedure table right afterwards and walk. I did have improvement in cosmetically, which is a wonderful side benefit, but I also have decreased swelling, decreased aching. Really, it's very minimal.
She got a great result. Her swelling has gone away completely, her pain has gone away completely, and her varicose veins have gone away completely as well.
Didn't find the doctor you're looking for on today's episode? Head to our website, bestdocsnetwork.com. There you can search our video library by topic, specialty, and doctor. The Best Docs Network, helping you find the right doctor and bringing medical education to you.